Okay, we've got a presentation here on Chapter 2, the Corpsman Manual, Expeditionary Medicine Administration. This chapter is going to cover the medical reports and logs and records that are commonly used by Navy medical and dental departments. We're going to talk about the maintenance and disposal of instructions and notices and the preparation of correspondence, and then we'll talk a little bit about the organization of the Fleet Marine Force and some fleet hospitals. In the first part of this presentation, we're going to talk about the reporting requirements for the medical department. There's a variety of logs and reports that need to be drafted by the medical department, and we'll get into a little bit of detail about these. Some things have to be reported to the officer of the day, and we'll talk about that. There will be some instances in which you might have to draft what's called a memorandum for the record. We've got to understand what SAMS is and what needs to be logged in SAMS, and SAMS stands for Shipboard Non-Tactical Automated Data Processing, SNAP, Automated Medical System, a acronym within an acronym. We've got to understand what MERS is and what we document in MERS, and MERS is your Medical Readiness Reporting System. We've got to talk about what's logged in the sick call treatment log. We're going to talk about what's logged in a training log, how often we test our water and maintain our potable water log, and we also got to talk about the planned maintenance system manual as well, the work-centered planned maintenance system manual. So our reports to the OOD. All important occurrences are reported by your SMDR to the OOD for entry into the duty log or the journal. SMDR stands for Senior Medical Department Representative, and this can be the Senior Medical or Dental Officer. It could be an IDC, especially if it's on an independent platform. Things that need to be reported to the OOD will include injuries, conditions that can affect the health of the crew, damage, loss, or loss of medical and dental equipment, names of patients that are in serious condition, and those will also be reported directly to the CO as well as the OOD. Anybody who's in serious condition with the information that's necessary to notify the patient's next of kin. Memorandum for the record. So we might have to, memorandum of the record are prepared in any event of historic or legal importance for which good judgment dictates that it should be recorded. So if anything happens that you feel might have legal implications or historical implications, it's a good idea to document it, okay? And the format you'll document it on is what's called a memorandum for the record. And a memorandum of the record needs to be drafted in accordance with SecNav Instruction 5216.5, which is the Department of the Navy Correspondence Manual. That's where you can find the correspondence. So some instances in which we would do that. Well, first off, it's a medium for recording special occurrences that might need to be reconstructed in detail sometime later, especially if it's legal, right? You might have to testify on that, so you want to document it, and like I said, in a memorandum of record in accordance with the correspondence manual. So it might be drafted for a serious injury or death, a patient who refuses treatment or is non-compliant, and then also recommendations to the command that are not followed. So if your command wants to do something that's blatantly unsafe or hazardous, and you advise them against it, and they go with it anyways, that'd be a perfect example for a reason to draft up a memorandum for the record, documenting that you advised the command about this situation, and they chose not to do anything about it. That way, if it comes back in a legal or a medical or in a legal way, I guess, then you would have proof saying that, hey, you fulfilled your responsibility as the SMDR and letting the command know that it was unsafe. Next, we're going to talk about SAMS, okay? And SAMS is an acronym within an acronym. So the S in SAMS, well, that stands for SNAP, right? And SNAP is the acronym that's within the acronym. So SNAP stands for Shipboard Non-Tactical Automatic Data Processing. And the AMS stands for, or the AMS, that stands for the Automated Medical System, okay? So SAMS, two acronyms, right? The S is the Shipboard Non-Tactical Automatic Data Processing, or SNAP, and the AMS, the Automated Medical System. So SAMS is an administrative tool, okay? It can track medical and dental readiness of the Navy Marine Corps operational units. Also enables your providers to update medical information and record medical encounters. So you can put all your immunizations in it and all your dental readiness in it. You can also do your notes in it. You can also document, like on a 600, a patient encounter. You can also track your supplies and inventory. You're going to log your preventative medicine inspections, like when when we do, we'll get into that later. You can report and receive radiation exposure data, and you can also manage your medical training as well. Okay, and so SAMS is a standalone. This is not connected to all the other programs. That's an important thing to remember to try to differentiate it from the other systems. Okay, so moving on to MERS, right? Your Medical Readiness Reporting System. MERS is an administrative management tool that is used to track the medical and dental readiness of every active and reserve sailor or Marine. It is a internet based, okay? So that means no matter where you're at, when it's updated in MERS, it's updated in MERS. If you're TAD over onto the East Coast for some reason, you belong to the West Coast, but in the East Coast, they know they got to update something in your medical readiness. If they do it over there, that's fine because it's internet based. When they look up your stuff again, when you get back to the West Coast, it'll be there in MERS. Okay, so it's an internet based communication program that allows for healthcare providers to update and manage a member's readiness regardless of the member's permanent duty station. And we'll get into the components of medical readiness in just a bit here, okay? The Central Data Repository and Defense Enrollment System, DEERS, allows SAMS and MERS to communicate and share information. Your sick call treatment log. So your sick call treatment log, this can be maintained in SAMS for each ship or activity. It contains a patient's report date and time. We need to make sure we get their name on there, their rate, what division they belong to, what their chief complaint is, their diagnosis, the treatment, and their disposition, okay? So, and disposition, whether or not they're SIQ times 24 or 48 hours, light duty times a week, or if they got the return to duty. Your training log. So all lectures and training periods should be recorded in SAMS and the training management module. Like you kind of saw on the previous one when we were talking about SAMS. SAMS records a lot of stuff. It has a lot of different modules in it, and one of them is a training management module. So any training we conduct in the medical department, especially like on a ship, we can record that in SAMS. So the information we want to record is the date, the title of the lecture, the division of personnel attending it, the duration of the lecture, the number of officers, chiefs, and E6 and below attending that lecture. Moving on to our potable water log. We've got to record the readings of daily residual chlorine and bromine levels. So once a day, we've got to test our water, and it's either going to be disinfected with chlorine or bromine depending on where you're at. So we've got to test that level every day, once a day. We've also got to record weekly bacteriological testing. So once a week, we have to test the water for the presence of bacteria, and we've got to log that recording in the potable water log. The record will be maintained in accordance with the NAVMed P5010 Chapter 6, and that's our preventative medicine manual. And then the results are recorded in SAMS and the environmental management module. So this is another thing that SAMS can record, our potable water. So our training, our potable water, readiness information, a patient encounter, those are all things that can be recorded in SAMS. Next, we're going to discuss the Work-Centered Plan Maintenance System Manual. This all falls under the Navy's Maintenance and Material Management System, or 3M. And what 3M is going to do, what we use 3M for is to record, report, and evaluate the maintenance requirements of the fleet. It is the nucleus for managing maintenance aboard all ships and the applicable shore stations and equipment. And guidance for this for the 3M system can be found in OpNav Instruction 4790.4, Ship Maintenance and Material Management System. And the idea behind the 3M system is that we want to substitute preventative maintenance for corrective maintenance, meaning we'd want to do the maintenance before anything breaks down or happens instead of afterwards when it's already broken. And the way we're going to do this is going to be accomplished through what we call PMS, which stands for Planned Maintenance System. And then you've got the PMS manual that reflects the planned maintenance requirements for a particular work center. So your reporting requirements, we'll go over what we talked about real quick. We talked about things that need to be reported to the OOD, like when somebody was seriously injured or conditions that are unsafe for the crew. We talked about memorandum of the for the record, how we would, when we would draft it, and where we go for guidance for that. Losing my train of thought here. correspondence manual, there we go, and the reasons we would do that, okay, like when we give advice to the command and they don't follow it, or when a patient refuses care, or something that might have historical significance. We talked about what SAMS is, right? The Shipboard Non-Tactical Automated Data Processing Snap Automated Medical System, right? The AMS of the SAMS, and all the things we can document in that. We talked about MERS, the Medical Readiness Reporting System, and that's where we just get readiness information, okay? So MERS doesn't do half the things that SAMS, we can't record half the things that we can record in things like SAMS. We talked about the sick call treatment log and what we need to put in there. We talked about the potable water log and testing the water once daily for chlorine or bromine, depending on what we disinfect it with, and then doing the weekly bacteriological testing. We talked about the training log, and then we talked about the work-centered plan maintenance system manual. So let's review a little bit of that with some questions here. What does the acronym SMDR stand for? SMDR. All right, SMDR stands for Senior Medical Department Representative. Which instruction is the correspondence manual? Which of the following instructions is the correspondence manual? Well, your correspondence manual is your SecNav instruction 5216.5. 5216.5. What does the acronym SAM stand for? What does the acronym SAM stand for? All right, SAM stands for Shipboard Non-Tactical Automatic Data Processing, or SNAP, Automated Medical System, the acronym within the acronym. What is the internet-based communication program that allows for healthcare providers to update and manage readiness information? Internet-based communication program that lets us work on readiness, that update readiness. Okay, that is MERS, Medical Readiness Reporting System. MERS, Medical Readiness Reporting System. How often are bacteriological examinations of potable water conducted? How often do we test the water for the presence of bacteria? We're going to do that at least weekly, right? Once weekly. On ships, where are the results of potable water testing recorded? All right, on a ship for sure. Where are we going to document our potable water testing? Well, that's going to be in SAMS in the Environmental Management Module. What does the abbreviation PMS stand for? And, in regards to 3M, what does the abbreviation PMS stand for? Well, that's your Plan Maintenance System. Moving on to Directives Issuance System. So our guidance for how directives are issued can be found in OpNav Instruction 5215.17, the Navy Directives Issuance System. And a directive is formal written guidance that informs and instructs Navy personnel, right? It tells us what to do, and they're issued from all sorts of entities. We get the BUMED instructions from the Bureau of Navy Medicine and Surgery. We get Secretary of the Navy instructions through SecNav SecNav. So an example of a directive will be instructions, and we'll get into a couple of examples too. But when we say directive, that's what sets down policy. That's what's on your bibliography, a type of directive, instructions. Okay. So instruction can be classified either as permanent or temporary. Permanent directives come in the form of instructions, and an instruction regulates administration. It establishes policy, it delegates authority, and assigns a mission, function, or a task. A notice is very similar to an instruction. Okay. It's a notice to request comments. We can use them to request comments or approval. We can use them to announce information like change of command or education and promotion opportunities. But the big difference between a notice and an instruction is that they cannot remain in effect for more than 1 year. Okay, a notice cannot remain in effect for more than 1 year. So two types of directives we've talked about: permanent versus temporary. Permanent will come in the form of an instruction, like all the instructions on your bibliography for advancement, and then a notice. A notice is something very, very brief. Just like they announce a change of a command, or to announce education or promotion. A lot of times PRT, right, a command will notify its members of the upcoming PRT in the form of a notice. And one other thing we're going to talk about is what's called a change transmittal. Okay, a change transmittal is issued to change instructions. And you'll see this sometimes on your bibliography. You see the instruction, right, with the numbers, and then there's a CH1 or 2 next to it. That's the change transmittal that's been issued for that instruction. Okay, so it issues changes to instructions and notices. They're numbered consecutively, with the most recent change filed filed on top of the instruction, okay? Your most recent change transmittal on top of the instruction. Correspondence. Your standard naval letter is used when corresponding with certain agencies of the U.S. government and some civilian companies. And we know we can find guidance on a standard naval letter in the same place we found it for the Memorandum of the Record. That's SecNav Instruction 5216.5, the Department of the Navy Correspondence Manual. Okay, next we're going to talk about the Subject Standard Identification Codes, or SSICs, and this is how correspondence is organized. You notice this if you look at your bibliography, all your instructions are numbered. There's a reason, right? There's a reason they are numbered that way. And we'll get into this briefly. I have an entire presentation dedicated to the bibliographies and the SSIC codes and why they're that way, and I recommend that you start your advancement study with that presentation. So we've got the numerical subject grouping. We've got the 1000 series, which pertains to military personnel. So any instruction put out by the Navy that pertains, that's setting policy for military personnel, it's going to be labeled in the 1000. It's going to be coded as 1000. 2,000 telecommunications, 3,000 operations and readiness, 4,000 logistics, 5,000 general administration and management. This is one we'll probably see on our advancement exam, but we'll really see 6,000, right? Medicine and dentistry, 7,000 financial management, 8,000 ordnance material, 9,000 ships design and material, 10,000 general material, 12,000 civilian personnel, 13,000 aeronautical material, and then our 16,000 that has to do with Coast Guard missions. So not only do we have the numerical grouping, but the standard subject identification codes are broken down into primary, secondary, and tertiary subdivisions, okay? So we've got the 6,000 medicine and dentistry. If we wanted to get into the primary number, we might see the 4, right? The 64. So 6 still medicine and dentistry, 4 a special field within medicine and dentistry. All right, moving on to the secondary number. If we have a 2 on there, that would designate it as submarine and diving medicine, and then the 1, hyperbaric treatment, are diving accidents, okay? So if we had an instruction on diving accidents and hyperbaric therapy, the 1 would designate it as so. The 2, that has to do with diving medicine. The 4, well, that's a special field, and then the 6, this all falls under medicine, and that's how you get to that instruction and the number, how that number is assigned to that instruction. And like I said, I have a presentation dedicated to this, and it goes into how the instructions on your bibliography are broken down, and I really do think you should start your advancement studying with that. Now we're going to talk about operational medicine and dental readiness, and we're going to start our discussion with individual medical readiness, or your IMR. We can find guidance on the IMR from SecNav Instruction 6120.3, which is the instruction that covers your periodic health assessment, your PHA, and your IMR. So, and if we want to look at the breakdown of the SSIC code a little bit, the 6 has to do with medicine, of course. So that's why this instruction is labeled as a 6,000, and this 1 has to do with physical readiness. All right, so this is individual medical readiness. That's why it's 6120.3. It's an instruction on IMR and periodic health assessments. So our IMR is made up of 6 elements, okay? And we've got to know these 6 elements, and we've got to know that there are 6 of them. The first one, we're going to talk about individual medical equipment. If you require something like a hearing aid, if you need red dog tags for like a medical alert or an allergy, that would be covered under individual medical equipment. Immunizations, if you're going somewhere where you might need anthrax or a smallpox immunization, that this would fall under immunizations. Medical readiness, readiness laboratory studies, making sure that we've got your current HIV on file, that we've got your G6PD study on file, that we have your DNA on file. That's all examples of readiness laboratory studies. Deployment limiting conditions, we've got to see if you've got anything that would preclude you from being able to deploy, if you've got any kind of a medical or physical condition that would stop you from deploying. The periodic health assessment, the PHA itself, is a part of your IMR, and dental readiness as well, okay? So 6 things fall under your IMR: individual medical equipment, immunizations, readiness laboratory studies, deployment limiting conditions, periodic health assessments, and dental readiness. Like we said, your periodic health assessment, all right, this is dictated by that SecNav Instruction 6120.3, and the purpose of a periodic health assessment is to correct those individual medical readiness deficiencies, okay, to get those IMR deficiencies. So all 6 elements of the IMR must be met, or a continued plan of care must be received for any ongoing medical conditions for that to be complete. All right. So for you to complete your PHA, all six of those things, all six of those elements got to be met, and we have to have a plan in place to meet them or deal with any ongoing medical conditions. Moving on to dental readiness. So dental readiness is broken into 4 classes, okay? Class 1, 2, 3, and 4. What it means for somebody to be a dental class 1, it means that they have no dental requirements, okay? No dental treatment is needed. If you're a dental class 2, you have an oral condition, but we don't think it's going to be an emergency in the next 12 months. We don't predict a problem with that in the next 12 months. If you're a dental class 3, however, you have an oral condition and we suspect it will cause an emergency in the next 12 months if it does not get treated. And when we say somebody is a dental class 4, that means that individual needs a dental exam. It's been past a year. We don't know the condition of their dental health, so we don't know what's going on. Their dental condition is unknown. Class 1 and 2 are considered deployable. Class 3 and 4 are non-deployable. All right, 3, we think there's going to be an emergency in the next 12 months, so we don't want you forward deployed where you might not have the resources to take care of that. And 4, we just don't know what's going on. All right, let's review again. What are the 3 directives we covered? What are the 3 directives we covered? There are 3 types of directives. Well, we talked about an instruction, which would be an example of a permanent directive. We talked about a notice, right? A notice would be an example of a temporary directive. And then we talked about if we need to change any of those, we would do it via a change transmittal. What are the 6 elements that make up a member's IMR? What are the 6 elements that make up a member's IMR? All right, your individual medical readiness will be made of individual medical equipment, immunizations, readiness laboratory studies, deployment limiting conditions, periodic health assessment, and dental readiness. What dental classes are considered worldwide deployable? What dental classes are considered worldwide deployable? That is dental class 1 and 2. Dental class 1 and 2, worldwide deployable. What dental class would a member be considered if they are past due for a dental exam? If it has been greater than a year, what would they be if we just don't know what's going on in that mouth? They'd be a class 4. So that just leaves class 3, right? And a class 3 means they have an oral condition that'll likely be an emergency in the next 12 months, so they are not deployable. All right, now we're going to move on to medical and dental support to the Fleet Marine Force. Your BAS, or your Battalion Aid Station, right? Your Battalion Aid Station provides direct support to company and platoon corpsmen and provides advanced trauma life support under fire. Your BAS, especially if an infantry battalion, is your most forward deployed and is normally comprised of 2 medical officers and 65 hospital corpsmen. Okay, 2 medical officers and 65 corpsmen usually make up, we call that your TO, but we don't need to get into that in this, right? But 65 HMs and 2 medical officers is usually what your infantry battalion, Battalion Aid Station is made up of. But other FMF medical support. The majority of your FMF medical support is going to come from the medical battalion, which belongs to MLG, Marine Logistics Group. Your MLG provides support beyond the organic capability of FMF units. So like your infantry battalion, that Battalion Aid Station, it's not going to have very much, especially organically to you. How far forward it is, they don't have great surgical, they don't have typically any surgical capability. So this is where you're going to get your more advanced stuff, okay, from your medical battalion. Your primary mission, casualty collection, emergency treatment, temporary hospitalization, specialized surgery, evacuation, and that'll do it. All right, so a primary mission of your medical battalion, casualty collection, emergency treatment, temporary hospitalization, specialized surgery, and evacuation. Your fleet hospital. All right, your fleet hospital provides medical support during intense combat operations and in lengthy, low-intensity situations. They are transportable. They're capable of performing advanced medical and surgical procedures. They're deployable in a variety of operational situations, and they're large. All right, HMs who deploy with the expeditionary military facilities, medical facilities with up to 500 beds. Fleet hospitals are designed to be used in operations greater than 60 days. Okay, fleet hospital, typically you want the operation to be greater than 60 days. They are organized with the command suite, the CO, XO, CMC, or triad. They're going to have a nursing services, medical services. They're going to have surgical services and ancillary services like your lab support and X-ray and all that stuff. And they're also going to have administrative services. And this is a picture of what a fleet hospital would look like. All right, this concludes this presentation on Expeditionary Medicine Administration from Chapter 2 of your Corpsman Manual. I hope this helps, and keep studying.